Some stories fade when the heroes are gone, but their legacy echoes through the lives they touched, the lives they saved, the battles they fought, and the courage they left behind. You might remember my previous story about the fearless Director General of NAFDAC, Dora Akunyili, who took on the fake drug menace in Nigeria. Let's revisit her incredible story and see how things have changed since then. Now, during her tenure, Dora Akunyili reduced the circulation of fake drugs in Nigeria from a staggering 80% to 15%. Yes, you heard that right. Her and her team worked tirelessly to ensure that Nigerians had access to safe and genuine medicines. Let's fast forward to today. Unfortunately, the statistics are alarming. According to the Association of Community Pharmacists of Nigeria, about 50% of drugs in circulation in Nigeria may be fake. As of 2025, NAFDAC has also reported that 20 to 30% of drugs in circulation may be fake, with some markets in Onitsha and Idumota having as high as 80% prevalence. Now, the World Health Organization (WHO) also reported that 10 to 30% of drugs and pharmaceutical supplies in developing countries are fake. That is a shocking decline from Madora's time. We spoke with some medical professionals, and here's what they had to say. Hello, everyone. So I am with Dr. Linda F. Young Agim here. Thank you, Doctor, for having us. Thank you for having me. All right. So very briefly, Doctor, can you kindly share your general experience about fake drugs through your years of practice? Okay, so I would like to start by saying that when patients take fake or substandard medications, negatively impacts on their treatment outcome. Okay. And consuming fake medicines or counterfeit medicines is a major cause of treatment failure. Okay, a good example is if a patient is hypertensive and the unknown patient will buy substandard blood pressure lowering medications, they are not likely to get the benefits of the medication as their blood pressure will be poorly controlled and they can go on to develop complications of the high blood pressure like a heart attack, a stroke, kidney failure, just to name a few. And another thing fake medications do is that they increase the incidence of antibiotic resistance. And this is when bacteria develop certain qualities or traits that make it difficult for antibiotics to have any effect on them. And I've seen this happen too many times in my practice, where even very simple infections become very difficult to treat because the bacteria that has been seen in the patient's sample was resistant to all medications that were tested against the bacteria. And then there's another instance of anti-malarial medication, okay, where a patient buys anti-malarial medication from one source and don't get any relief of symptoms, and they've been using that medication before now, and then they buy the same brand of anti-malarial medication from a different source and they get good outcomes. So you can see that no one has to tell you that there's something wrong somewhere. Okay, so that's what I've observed. Wow, thank you so much, Doctor, for this insight. So for the last one, can you kindly give us an advice? I mean, the general public, what do you have to tell us? Okay, so what I recommend is that patients should only use medications that have been prescribed. Okay, they should avoid unprescribed medications, and they should also buy medications from trusted and reliable sources, not just any random drug vendor or medicine vendor is approved, okay, to sell or dispense medications to the public. And I guess that will help in checkmating the consumption of fake medicines. Thank you so much. You're welcome.
Good day. Thank you so much for the invite, Wisdom. I'm really excited to be here. My name is Pharmacist Marvelyn Ekot, also known as Pharmacist of Value, and I have been inspiring over the years, an author of several books from And Pharmacy School Happened to make the lives of pharmacists and aspiring pharmacists easier, to Kaki Today Minted Tomorrow to make the lives of core members and aspiring core members easier, to my latest publication, How Are You? To make your life easier. And I've been a pharmacist for years. Even though I'm still an early career pharmacist, I handed over as the state coordinator of the Pharmaceutical Society of Nigeria Young Pharmacists Group, Akwa Ibom State Chapter, where I served between 2024 to 2025. And I'm currently the South-South Regional Coordinator of Young African Leaders Initiative, Regional Leadership Center, West Africa, Accra, Alumni Association of Nigeria, and a lot of other things. Several certifications, several awards, several recommendations and recognitions later. I am excited to be your guest, and I really commend the excellent work that you are doing. So, straight into today's interview. Okay, as a pharmacist, I've seen a lot in the fight against fake drugs, and it's one of the areas I'm very passionate about. Our role as pharmacists encompasses identifying fake drugs, solving or bridging the supply chain issues because fake drugs may penetrate into the market through the process of supply, to gaining patients' trust, of course, to make sure that whatever medications I dispense to my patients at all times are of high quality, they are standard, efficacious, and very safe. And sometimes you can experience the regulatory challenges in line with the supply chain of this medication. And one of the things that is really making me very passionate about this fight to end the menace of fake drugs in Nigeria is the fact that patients' lives have been entrusted into my care for their safety. There's the emotional distress that we face as pharmacists when patients are unable to get the quality of care that they expect or that they intend to get because the medications are not safe. This is why pharmacists are at the front line of ensuring that medications are safe and efficacious. You know, the pharmacists are the drug experts, the medicines experts, and we ensure that at all times your medicines are safe for you. The efforts to combat fake drugs among pharmacists includes, but are not limited to, collaborations with agencies to ensure that medications are safe, collaborations with pharmaceutical companies to ensure that the medications are up to standard before they get into the hands of the consumer. Thank you very much for your second question about the role of NAFDAC. NAFDAC is the National Agency for Food, Drug Administration and Control, and it's the body regulating the sales of medications and food in Nigeria, and they are very responsible for making sure that medications are safe at the point they are given to the consumers. They play the regulatory function through monitoring the manufacturing, licensing, the distribution of pharmaceutical products and medications to people, and they ensure that only authorized products are in the Nigerian drug market. Responsible for inspection of the premises that these medications and other products are stored, dispensed, and administered. And that is why they carry out routine checks from time to time to ensure that the quality of the medications, the safety, the efficacy is guaranteed for our patients. Thank you very much for that question, Dora Akunyili. That is a big name. In fact, I would like everyone to know that a lot of pharmacists are pharmacists today because of the way that Dora Akunyili bodied the profession of pharmacy. She ensured that she lived a very exemplary life, such that was Dora Akunyili in her time as Director General of NAFDAC, that is between 2001 to 2008, that transformed NAFDAC as a regulatory agency and brought it to spotlight. Before now, a lot of people might have heard NAFDAC, but when she came, she made the whole difference. She was able to reduce fake drugs in Nigeria to a bare minimum. The campaigns to shut down illegal drug markets, to burn down medications, to prosecute people who were dispensing fake medications, it was a lot. Even when she led the country as Minister of Information and Communications between 2008 and 2010, she rebranded the space. She was not just a pharmacist, she was an extraordinary pharmacist that brought in excellence into everything she did. As an academic researcher and a public health advocate, she changed lives, she transformed lives. You and I know how NAFDAC was highly rated as a body in Nigeria because of the impact and influence of that woman. May her soul rest in peace. Throughout her career, she earned several recognitions because of her good work. This is not to compare the time of Dora Akunyili with any other administration, but I can say that the woman made a lot of difference. Like Dora, be impactful, be inspiring, be exceptional. Okay, one word for the public is always remember that you should get your medications from trusted healthcare professionals only. And in this case, I mean your pharmacist. Your pharmacists are the custodians of drugs. We offer absolute pharmaceutical care at all times. We ensure that medications are safe, medications are effective, medications are of high standards before we dispense it to you. Don't get it from quack. Don't get it from the roadside. Don't get it from the market. Don't get it from undesignated places because of costs. Because when you say, I'm trying to save money, you would spend more by the time you end up in one or two problems. I can say that NAFDAC currently is doing an amazing job because I have seen, in fact, there was a recent case of Postinor 2 where they helped us to identify the fake Postinor 2 and the actual original or recommended or standard Postinor 2. They have been doing it from time to time, publishing different circulars, letting us know the medications that are safe and efficacious for us, shutting down open drug markets, and even going into the areas where these medications are produced, packaged, and distributed to ensure that the maximum standards of quality are maintained. So I want to say that get your medications from the right sources and do have a beautiful day. Thank you very much once again for granting me this interview, Wisdom. I appreciate it.
Good morning. I want to thank my respected colleague, Dr. Adedoyin Tolobonshe, for giving me this opportunity to be on this interview. Doctor, thank you very much. And the organizers. My name is Professor Sunday Olajide Abufisayo. I am a professor of biopharmaceutics and clinical pharmacy. I'm also a certified public analyst by Institute of Public Analysts of Nigeria. And so my researches revolve around originality, authentic drugs. And so the interview today has to do with talking about fake drugs. And interestingly, the first time I'll be on an aircraft, I was actually on my way to Japan, sponsored by University of Uyo, to attend a Silver Tetrahedron conference, where I will be showcasing the difference between the fake Viagra, sildenafil citrate by Pfizer, and the original. Difference in price, different in chemical composition, but similar packaging. And so Nigeria has been ravaged a lot by the menace of counterfeit, fake, substandard, spurious drugs. All kind of adulterants added that can make life something else. At the time, I researched into putting the fake one side and the original, enlightening people about the difference, buyers. And so fake drug merchants are making a lot of money from producing that at the expense of people's lives. And I'm sure you will not allow them to make a mess of you, as you will just take drugs as if you don't know there are fake drugs. So please beware. At the moment, I want to recognize the sacrificial role that Pharm Dora Akunyili, the former and late executive officer of NAFDAC. You all are witnesses of the kind of role, the passion with which she drove that agency, reducing fake drugs to the barest possible level. And we need people who have such resolute mind, like the late DJ, to help us in this country. I must tell us that fake drugs are in our hospital corridors. Fake drugs are in pharmacies that people don't know. It's not as if a pharmacist or anyone will want to prescribe fake drug to the other person, but they don't even know it. And that is why my agency or my organization is rolling out this test and stock program. We need professionals, pharmacists, and even indeed consumers to know how they can test before they use a drug, whether it's capsule, remove it, look at it, do this, do that, paracetamol, crush it, add a little stuff in a test tube, see what it's like. Because all of us have to be responsible. So I tell everyone at the chain, from the producers to the distributors to the unit sellers and to the users, everyone must be aware that there are some bad eggs who want to make a mincemeat of people's lives. And And you should allow them. A bird can fly over your head, but you can't stop it from perching with you. So fake drug is not for NAFDAC alone, it's not for the pharmacist alone, it's for you and me. And so, Colin, let's see how we can collaborate together. So viewers, NAFDAC is the agency of government that protects people's lives, safeguarding the lives or the health of the nation. And I am certain that the powers to do the job lies seriously with them. But knowing the kind of people we have in Nigeria, especially when it comes to persons who are making a lot of money from fake drugs, a lot of influences come to play. I am sincerely aware that NAFDAC will not compromise. But I can only vouch for myself. So NAFDAC has been doing a lot. But I still believe that NAFDAC can do more in terms of enlightening people, more in terms of collaborating with experts who have the same mind with them, and most importantly, collaborating with pharmacists.
Dora Akunyili's legacy is a reminder of what is possible when we have dedicated leaders fighting for a cause. Her work saved countless lives and protected Nigerians from the dangers of these fake drugs. We must learn from her example and continue to push for a healthier and safer Nigeria. So, what do you think? Kindly share your thoughts in the comment section below. Have you or someone you know been affected by counterfeit drugs? Let's keep the conversation going and continue to honor the memory of Dora Akunyili by fighting for a better Nigeria. Remember to like, share, and subscribe to my channel for more inspiring stories. Till we see next time. Thanks for watching.